we're welcoming home health folks today, and we have Princess and Hannah with us.
Yes.
So what is it you'd like to tell us about home health?
Well, home health is services that you receive in the home, which can be chronic illness, or acute or chronic illness, or you have social workers in the home to help you with resources that you need in the community.
Now, do we have social workers other than those that are assigned to each of our hubs, our neighborhoods?
No, those are the
same.
Those are the social workers we're talking
that's
about.
social services.
Yes, those are the same.
Yeah.
Okay.
Yeah.
So what else? And we're talking about home health, meaning in our apartments in independent living. Is that?
In your apartments, yes.
Yeah.
Once you
Okay.
discharge from the hospital or from Garden Ridge, then we provide services in your home.
Okay.
And these services have to be skilled services, meaning that they acute or chronic or an injury.
Yeah.
And the skilled services include physical therapy, occupational therapy, skilled nursing, home health aid, and social workers.
And those are for independent living, or is assisted living? Is assisted living over in Garden Ridge included in that?
Absolutely.
Okay, so we have an independent living and assisted living
Yes.
that you all
Yes,
provide services.
but we cannot go to the skilled,
Yeah.
to Garden Ridge, because it's also a skilled service.
Yeah.
So Medicare cannot pay two skilled services at the same time.
Okay, okay.
Can I just help distinguish the difference?
Now,
Yes.
what do you do, Hannah?
So I am a physical therapist
Okay.
by background, and
Okay.
so I just wanted to clarify just one thing about the certified. So Princess Department, we work in the certified home health department. So basically, we have physical therapy, occupational therapy, speech language pathology, and social services within the home, within the apartment.
Now, I think we understand physical therapy and speech pathology and so forth, but what's occupational therapy?
So the occupational therapy, they focus more on activities of daily living.
Okay.
So that would include like
Upper body
Cook.
strength, ADLs.
cooking,
Make your bed.
yeah, making the
Yeah,
bed,
okay.
grooming, washing up, dressing.
Yeah.
And also helping them with the utensils.
So
Those
for
what?
feeding utensils.
Oh, okay.
yes.
Yeah. So if they have difficulty bringing the hand up to their mouth, they have modified spoons and forks
Okay.
to help with that.
Okay.
So it's a big area for occupational therapy as well.
I'm sure it is, and you know, it's differentiating between the physical therapy
Yeah.
where you're trying to tone the muscles or get the muscles
Yes.
back, and so.
So the physical therapy focuses more on, for lack of a better way, focuses more on the lower body part, basically. And we do overlap with the upper body as well. But we work on the balance, on the gait training, transfer training, and bed mobility training, right?
Okay.
And the occupational therapy deals, again, for lack of a better word, mostly upper body. So dressing, washing, grooming, shaving, brushing teeth, feeding a person.
I guess I hadn't thought of it in terms of the
Right.
upper and lower body part.
Yeah. It's just a way of kind of, differentiating.
And this is a big part of home health, then, I would think.
Yes.
Yes, it is.
And of course, the skilled nursing.
The skilled nurse. How many skilled nurses do we have in home health?
Right now we have 4 nurses. We have 2 full-time nurses
Two.
and 2 flex, meaning PRN nurses.
Yeah. And they will come to people's apartments and provide the skilled nursing care that's required for what? Rehabilitation in the apartment
Yes.
rather than Garden Ridge? or-
Medication management.
Okay.
They're going to teach you about your illnesses.
About your what?
Illnesses.
Oh, okay.
Medication management, and also see if you are qualified for the other skilled services if it's not included in your care.
Okay.
So they make that determination, call the doctor, and see whether you need that services or not.
Now, are these covered by Medicare?
Completely covered by Medicare.
But they
Remember,
have to be prescribed by a doctor before they're covered by.
yeah, that's exactly right.
Yeah.
The doctor makes the determination whether the patient is homebound or not. So if you're homebound, once the doctor says you're homebound, then we go in and provide the services. So if you have to have Medicare or Medicare Advantage. If you have, you can have, because Medicare, it includes Medicare A and Part B as well. The Medicare A covers the first 100 days, and Medicare B picks up after the 100 days.
Okay.
So, and if you have Medicare Advantage, we can still provide you all the services as well, but you have to have a prior authorization and a referral for us to provide all the services that you need.
And the referral comes from the doctor?
The referral comes from the doctor.
Okay, what else we got?
So just another thing to add, I think also the skilled nursing does wound care. So if someone has issues with their skin, and although they may be going to a wound clinic, say once a week, but we have nurses that will do a follow-up visits to make sure that their instructions have been followed up.
Right.
So
I wasn't aware of that. So if if I cut my leg badly, for example, and I'm going to go to the medical center, get it dressed, and they're going to take care of it, and they're going to sew it up and whatever. But they're going to change the bandages for me, but you're still going to get involved. Is that it?
Well, you see, the thing is, the doctors at the medical center give us the referral. Once you go in there for the first time, they realize you need more services. They send us a referral, say, okay, home health, can you guys take over this patient? I need you guys to see this patient for wound to wherever it is. Then we pick it up from there.
Would you come to dress the room, wound every day?
The doctor sends us the order, and then we go in and provide the services, and we give the doctor update on how you're doing. So we also see patients who have surgical wounds, or if they have a broken hip being discharged from the hospital. That's when we go in there. The physical therapy is there to monitor, to improve functional mobility, and we are in there to make sure the wound doesn't get infected after discharge. And also another thing I want to bring up is the homebound status. Sometimes patients say, oh, if you're homebound, I can't leave the home. Yes, you can leave the home if you're homebound. If you have to go to a medical appointment, if you have to do grocery when you don't have anybody else to help you get that grocery, you have to go on your own, then it's considered, you still considered homebound. And if you're going to an adult daycare that is certified by Medicare, you can be considered homebound as well.
But you're fairly restricted, so you can leave your home for medical appointments, but you can't leave to go to the dining room, can you?
No, you can't go to the dining room.
Okay.
Yes.
So there's very few things that I can leave my apartment for if I'm homebound.
If you're homebound, and being homebound is the fact that you're unable to leave the home without the assistance of a person or medical equipment, which is a walker or wheelchair or crutches.
So I can be taken. I can't be taken from my apartment by a wheelchair to go to the dining room either.
You can have your food in your apartment.
Yeah.
Yes.
But I'm talking about my restriction to
Yes.
the apartment.
Right.
I can't have somebody transport me in a wheelchair.
Yes,
the dining
that
room.
is
Right,
correct.
that's
That is
correct.
correct. That's correct.
Yes.
I can just, so like another example I would say with the home care restrictions is, let's say you have a grandson or granddaughter or grandchild's graduation, which is once in a while, kind of a lifetime thing. If the arrangements were made where you have been taken in a wheelchair, special other arrangements have been made for your locomotion, for you getting in and out of that celebration and that event, you're still considered homebound, because
Right.
if those arrangements were not made, you would not have been able to go out. But if it's a weekly event, you're going coffee with coffee event with your friends and stuff, that would not make socialization. That would not make you homebound then.
Okay.
Right.
I mean, once I violate the homebound, then I lose your services.
Correct.
Right.
Correct. Then you can go to outpatients.
Yes.
Okay.
Yeah.
All right. So
Yeah.
if I lose, then I could go to, and if I go to outpatient, I can go anywhere else.
Correct.
Yes.
So that restriction has been lifted off from the Medicare regulations.
Yeah. Okay.
Yeah, once the goals have been met, the clinician decides, with the consent of the doctor, they decide which resources you're going to benefit from after discharge.
Okay. All right, we have 1 minute left.
I just wanted to add one more thing. As part of our therapy services, also with nursing, we also do a home assessment for safety. Safety is number one in our case. So we will have to make sure that there is nothing cluttered in the apartment, there are no throw rugs, there is nothing hazardous to the resident while they're in the apartment. So that's actually our big part of our assessment when we go into their home, make sure their home environment, their kitchen, their bathrooms, and their bed, they're safe and they can be in the apartment without any hazard.
Who initiates the home assessment?
It would start with the physician order, and a nursing usually starts a case, or a physical therapist will start a case, as we call it.
Because they suspect you have a problem like that, or?
But even if we don't, that's something we do have to make a point of making sure that someone's home is safe for them to be in.
Yeah.
So that's one of the main things we do when we start a case.
All right, well, I guess I still don't understand. Who initiates it? You say
It's part of the home health services. This is what we do when we go in for, let's say, physical therapy.
Right.
Yeah.
That's one of the areas we look at.
all right. So if you
Yes.
go in for a
Yes,
physical therapy,
yes.
but you just don't decide to come into my
No,
apartment
no,
and look
no.
at it and say, you know, that stuff over there has got to change.
That would be invasion of your privacy.
All right. Well, thank you all very much for coming today, and I think I've learned something,
Yeah.
and I hope everybody else has learned something.
And one thing I want to mention before we leave is Hannah is a new member to our team, and we're
Oh.
very thankful to have her.
Well, welcome.
I'm honored to be here. It's a privilege to be here.
It's a
Thank
great
you.
place to be.
Thank you. Yeah, it is. I agree.
Thank you.
Thank you.
Well,
Well, thank you for having us.
Well, it's our pleasure. Thank you.